In this video, you're going to learn everything you wanted to know about menopausal symptoms. Here's what you can expect to cover. First, we'll talk about what happens during menopause with the three major sex hormones like estrogen, progesterone, and testosterone. Then we'll talk about how early can menopause start, as well as a comprehensive menopause symptoms list. How long do those symptoms last? Solutions from a perspective of exercise, nutrition, as well as supplements. Which ones work and which ones are just hype. Before we jump in, who am I? And you might be wondering, why is a guy talking about menopause? Well, here's why. My name is Igor. I'm the author of the book, Mastering Menopause, Science-Based Menopause Diet, Exercise, and Supplements for Women. As well, I've been a personal trainer since 2006 with a specialty in menopausal women. I've also been doing presentations since 2013 to other personal trainers at some of the world's largest personal training conferences, and I've done over 400 wellness presentations to some of Canada's biggest corporations, including IBM, Bosch, American Express, University of Toronto, Investors Group, and others. If you want to learn when I publish more videos about menopause, symptoms, exercise, nutrition, and supplements, click like and subscribe to my YouTube channel. So let's jump in. What happens during menopause? Let's talk about estrogen first. Here is a study titled Relative Androgen Excess and Increased Cardiovascular Risk After Menopause. Here's what happens to estrogen. Throughout a woman's life after puberty, estrogen fluctuates with a menstrual cycle until 2 to 3 years before menopause, when it drops approximately 60% leading up to menopause. And then after woman hits menopause, it drops an additional 20% in the 1 to 3 years following her last period. That's estrogen. What about progesterone? Well, here's a study titled Progesterone and Human Cognition. Progesterone peaks around between ages 18 and 24, so somewhere around there, and then it steadily goes down until until menopause, when it goes down about 90% more than it was at the peak at the age of 24, 18 to 24. And finally, there's testosterone. Here's a study titled Relative Androgen Excess and Increased Cardiovascular Risk After Menopause, the same as the first study, which is basically testosterone peaks between ages 18 to 24 and slowly declines, but there's never a sharp drop like estrogen or progesterone. So while estrogen and progesterone both drop 80 to 90%, testosterone only drops about 10%. So before menopause, there was a lot more estrogen than testosterone. After menopause, there's more testosterone than estrogen because testosterone only went down a little bit. Now, how early can menopause start? Well, here's a study titled Relationship Between Intensity, Duration, Cumulative Dose, and Timing of Smoking with Age at Menopause. And here's what they found. Here were the results. The average age of menopause in most first world countries is 51. However, 5% of women experience what they call early menopause, which is between the ages of 40 to 45. And about 1% of women experience premature menopause, which is before the age of 40. Now, of course, if a woman has a hysterectomy, she goes into menopause as soon as she has a hysterectomy, regardless of what her age. She could be 18, she could be 25, she could be 50, but she goes into full-blown menopause right away. And fortunately, I do have a video on how to lose weight after hysterectomy. So check that out on your screen right now or in the description below. And so at what age do menopausal symptoms start? We know that menopause on average starts at 51, but do symptoms start with menopause or before menopause? Well, here's a study that answers that question. It's titled Menopausal Symptoms and Associated Social and Environmental Factors in Midlife Chinese Women. The results were this. Typically, menopausal symptoms start 4 to 6 years before the last period. And what can you expect? Well, here is a study, and the results were this. About 20% of women don't experience any symptoms whatsoever. They have a nice, smooth, easy transition. They have their last period, they never have it again, they never don't have a single hot flash, night sweat, etc. But 80% of women do have somewhere between mild symptoms and very severe symptoms, which we'll talk about in a second. Speaking of which, what are those symptoms? Well, this is a fairly comprehensive but not exclusive menopause symptoms list. Menopause symptoms are divided into 3 different categories. One of those categories is called somatic, the other one is urogenital, and the final one is psychological. So the somatic symptoms, the bodily symptoms, are the biggest one, which is hot flashes, night sweats, difficulty sleeping, insomnia, sleep disturbances, stuff like that, forgetfulness and headaches, joint pain, muscle pain, heart palpitations, dry mouth, dry skin, and thinning hair. These are just some of the somatic symptoms that women can often experience with menopause. There are also the urogenital symptoms. These are things like vaginal dryness, decreased libido, urinary tract infections, painful intercourse, and frequent urination, the need to go to the washroom very frequently. There are also psychological symptoms like anxiety, depression, brain fog, forgetfulness, irritability, mood swings, as well as a decreased self-esteem. And if you're listening to this list of symptoms and you're thinking, if you're not menopausal yet, you're thinking, is this what I have to look forward to? Well, then the question comes, how long will this last? So that's what we're going to talk about now. And there was a study to investigate this titled Duration of Menopausal Vasomotor Symptoms Over the Menopause Transition. And again, 20% of women don't experience symptoms, but the 80% who do experience symptoms, they last anywhere from 1 year to 12 years. And I realize that's a very wide range. The average is 7 years. Now, if you're wondering, can I do anything about it? Well, the answer is yes, and that's why I created this video. So what could be done about it? Here are a few solutions. On the nutrition side of things, you can eat flax seeds or take flax seed extract. Here's a study titled Evaluation of the Efficacy of Flaxseed Meal and Flaxseed Extract in Reducing Menopausal Symptoms. Here's the way this experiment went. They divided participants into 3 different groups. Group number 1 took 500 milligrams of flaxseed extract. That's a capsule, a supplement that you can get at a health food store. Group number 2 ate 2 tablespoons of flax seeds per day. And group number 3 took a collagen supplement, which was the placebo. Here were the results. The flaxseed extract group had a 25% decrease in all the menopausal symptoms. That's the psychological, the urogenital, and the somatic. And they also had a 26% decrease in hot flash intensity. The flaxseed group, not the flaxseed extract, they dropped their menopausal symptoms by 30% and hot flash intensity by 23%. The placebo group had negligible differences in their overall menopausal symptoms as well as their hot flash intensity. Now, here's an interesting one, beer. Can beer improve your menopausal symptoms? Well, here's a study that looked at that. It's titled Moderate Consumption of Beer with and Without Ethanol, that's alcohol, and Menopausal Symptoms. Results from a parallel clinical trial in postmenopausal women. Again, women were divided here into 3 different groups. Group number 1 just drank a regular beer with alcohol. They had one can of beer, 330 milliliters per day. Group number 2 had non-alcoholic beer, 2 cans per day. And group number 3 was a control group. They didn't drink beer. Here were the results. After 6 months of daily drinking of beer or non-alcoholic beer, the somatic symptoms decreased by 22%. The psychological symptoms decreased by 42%, and the urogenital symptoms decreased just a little bit, 8%. In the non-alcoholic beer group, their somatic symptoms decreased by 20%, psychological by 22%, and urogenital basically no change at all. What's the message here? That you should drink beer. Beer improves menopausal symptoms. That's the bottom line of that study. Now, aren't you glad you're watching this video? If you are, click the like button. Exercise. We know that exercise is good, but does it help with menopausal symptoms? Well, not all exercise is created equal. There's a right way to exercise for different conditions. There needs to be specificity in exercise prescription. Here's one study titled The Relationship of Various Physical Activities to Menopausal Symptoms. And here's what they found in this study, which is not exactly what you would expect. High intensity cardio and high duration cardio worsened hot flashes, but not other menopausal symptoms. High intensity is fine as long as it's low to moderate in duration. As long as you keep your high intensity workouts under 60 minutes, you should be fine, even with hot flashes. However, low to moderate intensity exercise, cardio that is, improve menopausal symptoms, including hot flashes. Whereas high intensity worsened hot flashes, but not other symptoms, although it didn't make them better either. If you're gonna do high intensity, you should do less than 60 minutes, okay? But again, it's still not totally clear how exercise in general affects menopausal symptoms. There's more research that needs to be done, and in a future video, I'll discuss that in more detail. Now, what about supplements? Which ones actually help with menopausal symptoms? Before I reveal the 4 supplements, I just want to make a quick disclaimer. I'm not a pharmacist. I don't know you personally. So if you are taking other medications, hormone replacement therapy, or anything else, there could be some kind of dangerous interaction between the supplements you're about to learn about and whatever medications you're taking. So before you start taking any of these supplements, speak to a pharmacist first. With that disclaimer out of the way, let's discuss what they are. One is black cohosh. Here's a study titled Black Cohosh Extracts in Women with Menopausal Symptoms. And here is what they found. The hot flashes decreased by 31.5% more than placebo using black cohosh. The somatic symptoms dropped by 41.8% more than placebo. Okay, so not bad. So, however, black cohosh had no effect on anxiety or depression. This is strictly when it comes to hot flashes. What about soy isoflavones? Here's the study titled Soy and Health Update. The results were this. With the supplementation of soy isoflavones, they reduced hot flash frequency by 20.6% more than placebo and the severity by 26.2% more than placebo. So not bad. But here's something even more powerful, sage leaf. And here is the study titled Effectiveness of Menosan Salvia officinalis in the treatment of a wide spectrum of menopausal complaints. The results were this. This one is even better than anything else. The sage leaf dropped all menopausal symptoms by 31% more than placebo, which is quite impressive, the best of any of these supplements so far. And finally, there's red clover. The study is titled Red Clover for Treatment of Hot Flashes and Menopausal Symptoms. The results were this. It reduced the frequency of hot flashes by 5 hot flashes per day. Whether a woman was having 20 hot flashes or 6 hot flashes, it dropped it by 5 per day on average. However, the higher the number of hot flashes a woman had, the greater the reduction. But there's less of an effect on the psychological symptoms, sexual and sleeping symptoms of menopause. This is really just when it comes to hot flashes. So if that's your issue, red clover is for you. If you're experiencing psychological, sexual, or sleeping problems with menopause, red clover is probably not going to help, and other treatments, other approaches are probably better. I have a video coming out very soon about how to improve sleep during menopause. And by the way, it's not supplements. Now, if one of the symptoms that you've experienced was weight gain and you want to learn how to lose weight after menopause, I have an entire playlist devoted just to that, which is all about the right diet, which foods to eat, how much protein to get, exercise, and more. So if you're interested in that, click on the link on your screen right now or in the description below.